For all living things, pain and death have by their nature been the largest and most persistent problems of existence. At some point in our past, or by some evolutionary process, the human species has developed a variety of sciences and religions to deal with the ill effects of disease. Underlying both the science and religion of any group of peoples is a basic philosophy, an approach to the world and universe which surrounds them. Peoples of European descent developed views which differed greatly from their neighbors further east. The way they experienced themselves as individuals, the way they believed their world to operate, the way pain was felt and expressed. Their world was experienced as singular. Man was the center of the universe, and all that stood around him was segmentalized, analyzed for causes and effects. Further east, it was different. The world and universe were sensed as being one with man. There were forces, opposites, which played in and on all of nature, above as below. They named these forces yin and yang. A man was not so much an individual as a part playing in these great forces of nature, as in nature so within the body of man. So it has become that there are two dominant approaches to healing, and only recently has one come to share its secrets with the other. Sincerity to alleviate pain and suffering, the underlying thread that binds them. Diagnostic approaches are quite different. In the West, it seems that symptoms are addressed primarily, whereas in Eastern medicine, a person's energy is brought into balance. In the individual, life energy, called qi, moves throughout networks or passageways called meridians. These meridians connect and affect organs, glands, and tissues. Symptoms, diseases, or pains are results of imbalances or blockages in the flow of qi. Diagnosis consists of finding where there is an imbalance or blockage in the qi, and treatment consists of 1. Building qi where there is a deficiency, 2. Removing qi where there is excess, and 3. Enabling its flow where there is blockage. This may be accomplished by a number of acupuncture techniques. The meridians or passageways connect the organs on the inside of the body with the points on the surface of the skin throughout the body. These points have long been documented and charted like a map on the surface of the skin. The acupuncture process is one that facilitates the proper flow of one's existing energies, and as a result, cures are effected. The earliest found document or book from which present-day texts have evolved is the Yellow Emperor's Inner Classics, compiled about 200 BC. In this book, there are references indicating the existence of prior texts and that the art of acupuncture had been established for some time. The theory and practice was spread throughout Korea and Japan by traveling Buddhist monks, and for centuries, new information was added. In the 17th century, Jesuit missionaries came to China, and through their offices, Eastern and Western medical information was exchanged. In Europe, acupuncture was begun in France and spread to Germany and England. Acupuncture came to America early with the influx of Oriental immigrants. However, its use and practice remained ethnic and stayed confined mostly to the Chinatowns of the larger cities. By 1949, many divergent schools of acupuncture united with the founding of the People's Republic of China. Mao Zedong encouraged the blending of China's traditional medicine approaches with those of the West. And in 1954, the Chinese government officially recognized Oriental medical practices. By 1958, there were 13 colleges of traditional medicine established, along with hundreds of traditional medicine hospitals. It was not until President Nixon's trip to China in 1971 that acupuncture had a more formal introduction to America. James Reston, an accompanying reporter, was treated with acupuncture for anesthesia and pain control during removal of his appendix. American medical delegations followed and noted with surprise and astonishment healing changes in patients with illnesses that would have been diagnosed as fatal in the West. Not by acupuncture alone, but by the use of herbs as well. In the mid-1970s, the first American acupuncture school was established. By 1982, a total of 12 schools of acupuncture were in existence. They joined together to form the National Council of Acupuncture Schools and Colleges. In late 1982, this council and the American Association of Acupuncture and Oriental Medicine together chartered the National Commission for the Certification of Acupuncturists. The purpose of the NCCA is to establish standards for safe and effective practice of acupuncture. The NCCA administers a national board exam and certifies practitioners who meet those standards. To be eligible to take the exam, one must have a state license, have completed an approved acupuncture program, or have studied under the tutelage of an acupuncturist for at least 4 years. Recent Western research indicates that the insertion of needles causes a release of endorphins, natural morphine-like substances which reduce pain in the body, which cause nervous system reactions affecting physiological and behavioral changes. Electromagnetism studies have found that the tiny but measurable amounts of electrical current are carried along the meridian pathways. It seems that acupuncture points exist at areas or points where there is least electromagnetic resistance. Research implies that acupuncture has the capacity of affecting both the physiological and behavioral function of the individual. Computerized thermography measures heat radiation at the surface of the body and transmits it to a color monitor. The skin shows up in a variety of bright colors, each representing different temperatures, in gradients of 1/2 degree centigrade. Insertion of acupuncture needles has been shown to increase the temperature of the area treated by significant amounts, resulting in increased blood circulation to the area by affecting the sympathetic nervous system. Acupuncture is widely used today for pain control. Treatment of pain by use of drugs may have harmful side effects and stress bodily organs. Acupuncture has been found to reduce pain with no side effects by making use of the body's natural functions. For this reason, it may be used safely during surgeries and dental extractions. With acupuncture, as the person's energy is brought into balance, not only do physical symptoms disappear, but emotional symptoms as well. Chronic and nagging problems clear up, as well as the more acute complaint for which one is being treated. However, acupuncture can be focused to treat specific problems. There are mental hospitals in China which use acupuncture as the primary modality in the treatment of schizophrenia, addictions, and psychiatric disorders. In America, the Lincoln Medical and Mental Health Center in the Bronx treats 200 patients per day for drug addiction and alcoholism with acupuncture, and for the psychiatric problems which often accompany drug abuse. Acupuncture has been shown to be of help in treating long-standing disorders involving weakness and pain, whether these conditions came about from past illness, injury, physical or emotional stress, improper diet, exposure to harmful toxins. Acupuncture also relieves abruptly occurring conditions arising from trauma. The World Health Organization recognizes conditions where acupuncture is effective, including common cold, sinusitis, colitis, neuralgia, sciatica, bronchial asthma, acute and chronic gastritis, headache, including migraine, low back pain, and tennis elbow. Clinical experience has proven acupuncture can help gynecological and obstetric problems such as premenstrual syndrome, infertility, and aftercare for new mothers. Acupuncture is also useful for weight loss, quitting smoking, and is very effective for strengthening the body's immune system. Acupuncture produces excellent results for athletes, provides relief from muscle pain, tendinitis, sprains, and produces rapid recovery from fatigue and injury. Children can also be treated with acupuncture. Diagnosis depends on the acupuncturist's ability to discern patterns of disharmony. Disease is not approached as something occurring only in one part of a person's body. It is understood only in relation to what is going on in the whole person. Many of the examinations done by the acupuncturists are the same as those by the Western doctor, but with a very different perspective. The acupuncturist looks, listens, asks questions, palpates, and takes pulses. Initially, a patient is asked to describe thoroughly his or her medical history, and any relevant information is recorded along with a detailed description of the chief complaint, including medications taken. Lifestyle and diet is ascertained and can prove invaluable in diagnosing illness. Acupuncturists are trained to be sensitive to subtle variations in skin tone, coloration, and mannerisms. But of all the visual aids, the acupuncturist views the tongue with special importance. They would look for change in shape, coloration, texture, and coating on all areas of the tongue. These changes tell the acupuncturist how far from the optimal the patient's condition is and give specific clues as to the condition of qi in the body. And as treatment progresses, definite changes will be noted. Touching is another means of assisting the diagnosis, and this is often accompanied by the practitioner asking questions, such as, is pain increased or lessened by the pressure? And is it aggravated more by heat or cold? Abdominal palpation can give many helpful clues and can be an important procedure. In contrast to Western approach, there are 6 pulses in acupuncture which correspond to different organs. They are taken on the wrist and require attentiveness and skill on the part of the practitioner. The patient and acupuncturist should both be relaxed. The pulses are taken at 3 levels of pressure. First, the skin is touched lightly, then slightly harder, and harder again. Pulses can vary in many ways: speed, strength, pattern, reflecting disharmonies in the body. A great amount of information can be gained by this means alone. The insertion of needles into points on meridians requires a practitioner to be thoroughly familiar with the location of points on the patient's body. These points are located along 14 main meridians. Over 2,000 points have been found to exist. However, in practice, less than 200 are usually used. Throughout history, copper or wooden models have been used along with various charts to assist the location of points. Each meridian is named by its corresponding organ, and points along it are numbered sequentially, such as gallbladder 21 or large intestine 13. During treatment, a number of points are taken. The needles themselves have a long and interesting history. The earliest needles were fashioned out of stone, bone, and bamboo. As technologies developed, they were followed by ceramic needles, then bronze, gold, silver, alloy, and stainless steel. Most needles used today are made of high-quality stainless steel. A good needle must be strong, flexible, round, smooth, and pointed to ensure pain-free insertion. Western syringes used for taking blood or for giving injections are very much larger, since they require a hollow core through which fluids must pass. Sewing needles are larger and much more rigid. At one end of the needle is a raised area or handle. These are fashioned in different ways, but serve the same function, providing the acupuncturist with a means to hold the needle. Before a needle is inserted, the area is cleaned with an antiseptic solution. Needles are designed to move the tissue apart rather than puncture it, and often the patient will not even know when a needle has been inserted. As the needles are inserted by the skilled hands of the acupuncturist, the skin may be pressed, stretched, or pinched to facilitate the insertion. They may also be inserted with the aid of a tube, a 17th century Japanese invention to minimize pain. The needle is placed in the tube, set on the skin, and tapped in. The direction or angle of needle insertion depends on the individual acupuncture point taken. The depth varies with the areas of the body, the goal of the treatment, and sensation. The patient may feel a number of sensations at the point: tingling, warmth, or a number of other novel sensations. Once the needles are inserted, the acupuncturist may perform a number of auxiliary needle manipulations, which may include twirling the needle or moving the handle in different ways, each with a unique and different result. For needles to evoke the vital energy they may need to stay implanted, usually between 15 and 30 minutes. The needles are withdrawn painlessly. If a needle is used more than once, it is sterilized in an autoclave, as are instruments in any Western medical clinic.